Hi, everybody. Welcome to our Health Careers Cast, Episode 2. This is a series, a podcast where you can hear and learn more about different healthcare professions from professionals and students themselves. Today's episode, we have Porsha, who is a certified physician's assistant. Learn more about why she got into becoming a PA, what her experiences were like, and how the process was like for her in becoming a physician's assistant. Keep listening to hear more about it. Hi, Porsha. Welcome to our Health Careers Cast. We are super excited to have you with us today to talk about your experience. So thank you so much for joining again. We really appreciate your time. So before we start, would you like to give us a brief introduction of yourself?
Sure. So my name is Porsha Pruchnicki. I graduated from the University of Waterloo in 2016. I had to think about that. I have an honors biomedical science degree with a minor in psychology. Jeez. And then after that, I went to the University of Waterloo and I completed the physician assistant program. And I've been working as a physician assistant ever since.
And as a physician assistant, can you describe what you typically do at work?
So that really depends on the area of medicine that you're working in. So the best way to understand what a physician assistant is you're an extender of your supervising physician. So I work directly under the scope of the physician I'm working with. That being said, I work in two different kind of roles. So right now in family medicine, I have 5 different supervising physicians. So when I work under their scope, each one has their own specialty and their own way of practicing, which means when I'm working technically under them, I'm practicing with their style, versus when I do specialty work, I'm practicing under a different kind of model of medicine. Again, my expertise changes. So as a PA, you're really fluid in terms of what you do. The beauty of it is you can really work in a diverse area of medicine, and you'll kind of learn all the different positions I've had throughout the year. Mostly in family medicine, my job is just like you would see your nurse practitioner or your GP. You'll come in with any complaint. It really doesn't matter what it could be. It could be chronic or acute. It could be a well baby check. It could be vaccines. It could be you want to get stitches out. You want a biopsy. You want to talk about getting blood work done, review a lab, whatever the problem is, I really deal with that. Really, our job is to try and deal with the most acute and kind of, I guess you could say, more simple cases, but that doesn't always happen. Sometimes I deal with more complicated, and then depending on my level of experience and how comfortable I am with the problem, I'll go and speak and discuss the case with my supervising physician or just the team in general to come up with a good plan. But yeah, that's pretty much what I do in family medicine. I also work in otolaryngology, and in that practice, I specialize in ear, nose, throat. So really it's a completely different way of medicine. Any knowledge I have in family medicine, I don't really apply because I have to work within my scope, under my physician scope. So you're dealing with more specialized kind of things. So whether it's chronic ear infections, tinnitus, determining surgical cases, determining candidates for cancer, like skin cancer removal, things like that.
And now those are the 2 main areas that you work in currently?
Currently, yes, but I've worked in other ones before.
These are the 2 current ones that you're working in. And are you ever going back to the other specialties or areas, or how does that work?
So it really just depends on your contract. So when I first graduated, I took a year position in family medicine. So I was working in Brantford. And at the time, I was a full-time job. So every once in a while, I would work for one of my old preceptors who happened to specialize in otolaryngology. So I would go on my days off, or if I got off work early, or if there's a half day, I would go work at the other clinic. So I was kind of doing that. The physician I work for in family medicine, he had a specialty in addictions, cannabis medicine, as well as being a general practitioner. So because he ran his own cannabis clinic and family medicine, I ended up having that experience as well. And then when that contract ended in December, I found new work. So I was working in 2 private otolaryngology clinics, one in Cambridge and one in Burlington. And so I wasn't doing family medicine. And then in March, I transitioned because of COVID. A lot of our private clinics were closed at the time. So I actually wasn't doing PA work for a little bit. Really, I shouldn't say that. It was really 1 week. Then I got work again. But I actually worked at St. Mary's Hospital in Kitchener, and I was just doing pre-screening. So really nothing clinical. I was just your basic screener for COVID symptoms. And then again, about a week later, I started doing that job. I joined Hamilton Health Sciences, and I was doing their COVID support team, which was a group of 10 PAs of all various backgrounds. We were rapidly trained and kind of just told to jump in and fill the needs in the urgent care and the emerge. So I did that for 4 months, and I was also then working part-time in the otolaryngology clinic in Cambridge. Then I eventually figured that I should drop the one position in pre-screening. So I went back to just pure physician assistant work, and my contract at Hamilton Health Sciences in the emerge and urgent care, that ended. It was just a temporary position for 4 months just to kind of help deal with the first wave and the demands. That ended in July, and then I was offered a position actually through LinkedIn. I had a recruiter message me about this remote occupational medicine position in Nunavut. So I went to Nunavut for a month and worked in remote medicine. And then when I came back, I started working again in that otolaryngology practice in Cambridge. She was is a great boss, and she's kind of let me be fluid and go wherever. And then starting in September, I transitioned back into full-time family medicine at Hamilton Health Sciences. But being crazy, I decided to also pick up some extra otolaryngology work in the evenings and weekends. So that's how I've managed that. But I don't think that's a normal path for PA, but it just happened to be what happened.
Yeah, that's awesome. It sounds like there's a lot of transitioning from different places. How is that like for you? Do you like that flexibility part of your job?
I mean, I think had you asked me as a new graduate, I probably would have said no. I preferred having one job and knowing it was stable. But then after that contract wasn't renewed, it kind of forced me to have to just be more adaptable and start applying for things that I wasn't really comfortable with. There's like certain specialties that I'm not very interested in, but being a new graduate, really I have to make my resume as best as I could. So I kind of took any opportunity. I had no interest in going and working in Nunavut, but I figured it was a once in a lifetime kind of opportunity, not only to see the territory, but also just to see if I could do it. I would never do it again, but I'm glad I experienced it.
Yeah, that's awesome. Do you ever spend your time in research, or is it more just like kind of the frontline work?
What do you mean by research?
Like, for example, when you were talking about cannabis, is there any like research that goes into it, or like doing the research part?
Oh yeah. So at the very beginning, when I was working, we were collecting data and we were sending it. It was a partnered kind of. I would do more of the clinical assessments and make sure that all of the questionnaires that were needed to collect the data for the research to be done was done. But I wasn't the one writing any papers or actually analyzing that data. I was more just the clinician involved.
Okay, awesome. Yeah. What do you consider to be the most exciting part of your work? It seems like there's a lot of experience that you've had, but if anything that jumps out, yeah.
I think the most exciting part of my work is that I get to practice medicine. So when I was in high school, my only dream was to become a physician, because you don't really think of, like, when I was thinking of what can I do in medicine, I think of nurse, I think of doctor. I didn't even think of anything else. I didn't think of pharmacist. I didn't think of dentist. I thought of nothing else because those are the only two things that I thought of. Yeah. But then after going through, a lot of people, because you just don't know. And you go through high school, you have your plan, you get into university, you go through university, and then you get to the end and you're like, my God, trying to get into medical school is not as easy as, well, nobody ever says it's easy, but it's difficult. And I started really reevaluating my life if I wanted to spend the next couple years. Because, I mean, if you think statistically, your likelihood of getting in on the first go isn't high. And I thought about myself, and I know the type of person I am, and I didn't want to wait. I wanted to get into the workforce, but I knew that I didn't want to compromise patient care, and I didn't want to compromise basically what I like doing, which is being a clinician. I like diagnosing. I like seeing a problem from beginning to end and solving it. And then when I went to my career advisor at UW, because I said, basically, this is my degree. What can I do with it? She mentioned PA, and I was like, what is a PA? Never even heard of it. And then I went to one of the open houses at McMaster, and I still didn't even understand the role, because if you try and find a good definition of a physician assistant, you can't. It doesn't really exist. The best way is if you compare what we do to a nurse practitioner and then kind of modify the definition. And so I was still so confused, but I thought, you know what, based on what they're saying, this sounds like everything I want. I just kind of took a leap of faith and I just went into it, and it's been a really good choice.
You're here.
Yeah.
That's awesome. You were in, when you were in undergrad, did you go through different decision makings? Did you decide not to go for medicine for a bit, or was that always something that you really wanted to go into?
I think, again, when I was in high school, I think I had it all, I thought, planned out, and I had my pathway line that, like, okay, I know exactly what courses. When I was in first year, I knew all the classes I was going to take in fourth year. Like, I had planned and planned and planned, which I really realized was, your plans never work out. I don't know why I tried so hard, but that was my idea. And so, yes, my main goal was medicine, medicine, medicine. But then it was, I think, around my second or third year, that's when I first wrote the MCAT. And I was trying to think, well, what else can I do? And at the time I was working as a pharmacy assistant. And so I thought, well, talk to the pharmacist. Maybe pharmacy is something I never considered. And I worked for this awesome pharmacist who was so funny, but he hated his job. So, you know, he kind of just deterred me. He's like, don't become a pharmacist. And so that was the end of that. Like, I loved working with him, and I understood the role, but it was just, he would tell me a lot of negative parts to the job that I was like, you know what, fine. Okay. So that kind of ruled it out. Then I thought, well, what about optometry? Then I thought, God, I hate physics. And the fact that I'd have to take physics later on, it was like a no-go. Dentist, I don't think I ever really considered. I was just like, meh. Nursing, I don't know why. I didn't even put any thought into it. I was like, no, it's doctor or not. And then I kept thinking, well, God, what if I don't get in? If I don't get a medical kind of role, what else can I do? So then I considered research. And then one day I was like, well, I might as well figure out what this is, because I have no idea what it takes to do research at all. And so I approached one of my professors, is Dr. Reed. He teaches, or was teaching, embryology. And anyways, I came up to him one day and I just said, hey, what can I do to get involved in research? Because I knew he had a fly lab. That's all I knew about him. And he said, well, I can get you to flip flies, which literally is what it sounds. You take flies, you gas them with CO2, dump them into another tube, and that's your job. You're responsible for a tray of flies. And it doesn't sound like an important job, but they each have, you know, very specific gene changes. So it's very important for research. That was the one job. And then he said, hey, I need a student for the NSERC, which is like a grant to continue research. And he's like super into flies. I was like, it's not really my area of research, but he said, I don't really care if you're qualified. It just, you know, he obviously wanted the money to do the research. And I thought, you know what, this is a good idea. And this is a good experience for me to do. I quickly learned research is not for me. It was extremely isolating. I mean, I was dealing with flies most of the time. I did like really get some good dexterity, because like part of my role was you'd want to create a certain batch of flies, and then I would gas them out, and then I'd put them under my microscope, and I would basically like dissect their guts, the colon part, and then we'd stain them, and then I'd take them to the microscope room and then count these cells. I did that for 3 months. And I remember he told me at one point, okay, Porsha, your job is to create this like certain group of flies. And he wanted to test this one gene and to see if we could modify the cells. I think I failed the experiment 12 times. Like, I just couldn't get a good enough sample size. And I just learned that it was never going to be for me. I was not passionate enough about the research. I didn't like not being around people. And I was like, God, what if I don't find anything with this research? Like, to me, it was just so, yeah, it was disappointing. I couldn't do it. So that's what I think eventually like said, okay, nope, I would think I'm on the right path of going into medicine. And then even, you know, I had a psych minor, so maybe like counselor and things like that. But then it was my parents that was like, no, don't do that. Because you're going to have to sometimes listen to some really difficult stuff, which I still do in my job now. But they were convinced that if I went specifically into just psychiatry or became a psychologist, that would be an issue. So yeah, that's kind of, I tried a couple things and then I came to realize that I think clinician, but you never know until you jump in. There's no
Yeah.
good answer.
Yeah, no, that's awesome because I mean, there's so many different options in health careers, not just like medicine, optometry, and everything. So
Yeah.
I think that reaching out and trying different things is really important to figure out that passion. Yeah, that's
And
amazing.
talking to people in the role, my God, that is so huge. Like I said, like pharmacy, I would never have known. Or I think I even met with my optometrist at one point. Like every healthcare profession that I was kind of interested in, I said, hey, can I just talk to you about like what do you like and what you don't like about your job? And kind of did little my own interviews. And it really helped me kind of make a decision.
So you did a lot of like informational interviews with them?
Yeah, I mean, I just kind of would, like, so my own GP, I kind of talked to him at one point. My optometrist, I said, hey, like, tell me about it. Yeah, just certain ones that I was really interested in. I was like, if you have some time, I just had some questions. It was very informal and just to get a little bit of information. And then when I heard about PAs, my big thing was like, well, I got to interview a PA because I kind of want to understand, like, is this job sustainable? Like nobody seems to know what a PA is. Do they even exist? Like they were hard. It was hard. I think I found one person who agreed to meet with me and she told me about how she was doing and yeah, it sounded like it was a good match for me.
Yeah, that's awesome. Reaching out is really important.
Mm-hmm.
What would you say is the biggest challenge in your work?
I think the biggest challenge right now is just people don't understand or even know that PAs exist. And so it can be a little bit frustrating. I mean, sometimes when I go into a patient encounter, we're pretty good where I work now, but I've worked in a couple different areas of medicine where they don't understand what a PA is. So I often get mistaken for a nurse, a student, or like on my way to be a doctor. And then when I kind of explain my role, they still don't really understand. um, and then sometimes if I do explain my role, but because of the name, I think physician assistant in general is like a poor name. I personally just don't like it. People get confused and they think I do admin work, so that I mostly just answer the phone, but that's not true. I am a trained clinician. And we've talked about this, PAs in general coming with a different name. And so far, I don't know if that will ever change, but that can be challenging in itself because the name just, again, it kind of throws you off. So that's a huge challenge. I would say most of the time, once I'm able to kind of explain my experience and what I do, it's not a big deal. Oftentimes what I found is I just kind of go into the encounter. I really just introduce myself as a person. I don't introduce myself always as a PA, and maybe some of my colleagues would argue that that's wrong. And I go through the whole encounter because my job is to kind of prove to you that I know what I'm doing. And usually by the end of the encounter, they feel great. They're happy with the plan. And then they'll say, thanks, Dr. Porsha. And then that's when I correct them. I say, actually, I'm a physician assistant. They're like, wow. Because I think that way I've earned your trust throughout the appointment, as opposed to when I say, hi, my name is Porsha, I'm a physician assistant. And then I have to not waste time, but basically take time to explain that. And then sometimes there's a little bit of, you can tell they might be a little bit hesitant to see me, or again, they'll question whether I'm a student, and this just kind of goes the wrong way. So I personally, that's how I enter all my encounters. I think it just makes me come off more confident, and yeah, I get to get away from that until the very end.
Yeah, awesome. I'm curious, do you ever assist with surgeries as well?
So PAs can, in otolaryngology, they're all solo surgeries, except for things like hemithyroid, or so half of the thyroid or the full thyroid being removed. In those cases, I did as a student, I would first assist. And as a student, in general surgery or obstetrics, things like that, I did first assist. I just currently don't because of my position, but a couple of my colleagues do.
So would you like to go into surgery again?
Before I became a PA, I wanted to be a general surgeon. I love the OR. I think it's great, but I would want to be the one doing the surgery, not just assisting. So I think that's where I would want to go back to become a physician.
Awesome. It's a good segue because my next question is, if you could go back, would you do anything differently?
There's been periods of time, I talked to you about how this year I've had, I think, 6 jobs. Yes. There are many points where I've been frustrated and just like the lack of integration of physician assistants in Ontario that I've really considered, should I go back and become a nurse practitioner? Should I go back and become a physician? So I've struggled with that, I would say, throughout my career. I mean, I love what I do, and when I have a job, it's fantastic. Everything's great. But when I don't, I go back to that place of what, should I do that again? And I don't know, I think I would have actually compared the difference between a PA and an NP, because I never even thought about it. I don't know if it was like the timeline, because now in retrospect, for me to become a nurse practitioner would require me to become a nurse, a registered nurse, which is 4 years, and then do a 2-year master's in nurse practitioner, versus me, I did my undergrad, and then it was 2 years of additional university. So that's 6 years. Mm-hmm. So I don't know if it was timeline wise, and also I just don't remember at that time looking into it. But I think that's one thing I would do a little bit differently, is just compare and contrast.
Mm-hmm. Yeah. Is there something that you think will be helpful for individuals who are interested in going in the same profession as you, or a similar path, to think about before going into it?
I mean, I know, for example, like really it doesn't just apply to PA, it kind of applies to anyone who wants to go in to some kind of clinical role. We all take science as a background, and then we try and get a minor, and we all get a psych minor or something. So I think like trying to make yourself stand out, because like not even like for me, I mean, I did exactly what I just said, so I didn't really stand out. But for example, like any line of work, you want to stand out from your peers, right? You have to make your application better. So for example, my friend, he wanted to be a police officer. He actually did police foundations, and then he did a nursing degree for a year before he got accepted. So that's one thing, is like really trying to make yourself unique. I mean, there are people who get accepted to med school and they have an arts degree or music or whatever, because it's something that sets them apart. That being said, look at the core requirements, because U of T has a certain thing. I think you need to take physiology, you need to take anatomy. There are certain prerequisite courses that you should take. I personally am a believer in, like, if you're going to go into something science, you should probably have a background, right? Like, it's easy for me to understand the terminology, to understand the body systems, to understand what's going on, because I spent 4 years prior learning about it. So I would find it difficult coming from a different background. That being said, it makes you a little bit different. If you want to become a PA specifically at U of T, you have to have a certain number of hours of clinical experience. So that's really important. You can't just apply with an undergrad with no experience, because that's a requirement. You can apply to make master though, but with U of T, so I mean, in terms of clinical experience, I know it's probably difficult right now with COVID, but when I was a student and COVID didn't exist, I volunteered at Freeport Hospital. So I was part of the HELP program. So it's like a delirium prevention program. But even one of my colleagues right now who is a PA, and he's actually going back to medical school, he is volunteering for like Kids Helpline. So that's another thing, because it's virtual, it's socially distanced, so you can do that. I'm trying to think, like, the background of PAs was all different. Some were kinesiologists, some were physiotherapists, some were paramedics, some were medical assistants, medical clerks, or they did like radiation therapy, something like that, like nuclear medicine. So really trying to get that medical experience. I mean, those are all careers, and they finish their degree in something else. Mine happened to be volunteer, and pharmacy assistant counted as one of those too. But yeah, that's important for becoming a PA. I guess the other thing, like pathway wise, is like just trying to actually connect with a PA, just so you can get a better idea. Like you should really kind of research, I guess, the demand and where you live. So for example, I'm from Kitchener-Waterloo. I find it extremely difficult to find work in KW. I have yet to actually find a job in KW. I have found work in Cambridge, Burlington, Hamilton, so a little bit further away. So I mean, if that's something that's important, you staying where you are, you should kind of know where the jobs are. And you should be willing to be flexible and adaptable, because again, PAs, we're in the process of becoming regulated, but there's still some work that needs to be done. And there are times where you might find some issues with either your clinic not being able to afford you, or just some, maybe concerns from your physician who's hired you. I don't know. You just have to kind of be able to roll with the fact that it's a progressing and a newish kind of profession in Canada.
Yeah, like I mentioned before, it seems like there's a lot of transitions too, based on your experiences this year alone. Yeah, that's awesome. Were there times where you felt demotivated when you were working towards this profession? And then if you had, what helped you feel motivated?
Like trying to become a PA?
Yeah, or any part of your process.
I would say as a student, that was never really an issue. I'd say the only time I got really demotivated was towards the end of the program. So the first year is more kind of in-class learning. The second year is all didactic, and you're going out to rotations and you're learning how to take a medical history, how to do a physical exam, how to come up with an appropriate plan and assessment, present your cases to a team. So after I did that, there was a period of time where I was studying then for the certification exam, and I was fine with that. But then there was an issue where the new grants weren't posted. And so I started panicking that, oh my God, if they don't post any grants, then I'm not going to get a job as a PA. So that really was frustrating, because I thought, oh my God, I just spent 2 years of my life trying to become a PA, and this isn't something that might be possible. So that's where I got really demotivated. I mean, luckily the grant did come out and I happened to get a job through that grant, but that was something that really, I got so upset, and I really doubted whether or not being a PA actually was the right choice. And I actually ended up going back to work part-time as a physiotherapy assistant, or not physiotherapy, a pharmacy assistant.
When you were in undergrad, were there any resources part of URLU that you used that helped you, or anything?
The best resource was the Career Center, because the best thing you can do for yourself when you're in university is take courses that are smart. Sure, it's fun to take classes that you like, but unless it's going to help you later in life, you can learn about that for fun. Like, don't waste your money and time. Seriously. I don't know. That's just my philosophy. Mm-hmm. So when I went to the career advisor, and again, I sat down and said, well, what can I do with this degree? That's important. You should know at the end of the day what your degree can do and can't do. Because you don't want to come out with a degree that's useless, right? That's a lot of time and money again. So I found my career advisor super helpful. We kind of talked about all the different pathways. And then when it came to prepping, that was huge, because they run MMIs, so the simulated interviews. And I went to like 2 or 3 of those to practice. And I think that's what really helped me in my interview, because it wasn't a surprise, right? Like, I knew the general format. I knew it was going to happen. You get to start perfecting your answers, and the best part is like you practice in front of them, right? You always get those standard questions. Tell me about yourself, but you have to remember, like, they're tricky questions, right? They're not just, they don't care, if you have a dog or you like the color blue. They want it to be related to the profession, and so you have to answer them smart. But if you're not in that mindset or thinking about how to take an interview, again, you can miss out on those helpful kind of hints. They also gave me a couple books to read. So I read about like medical interviewing. They gave me tips on, you have no idea what's going to happen in that room. So try and like be aware of current events. Another important thing for like interviewing that they told me was, if you want to stand out, answer the question, but also relate it to a personal experience. Because then they walk away with something about you, but you're still done a good job of answering their question. And just like, really, when you're doing an interview, especially a medical interview, they want to see your thinking process. Everyone who comes into those programs successfully is a critical thinker. Mm-hmm. They don't want to just be like, yeah, I just know. That's not helpful. I want to know why, because it will apply later in life. Somebody comes in with a cough, you're like, yeah, I don't care about it. Why don't you care about it? Because I've ruled out this. Or I've done this test and it's all normal. You have to be able to show that, because again, it just helps you. It's so helpful later in life.
Yeah. I've been part of the MMI simulation. It's like they do it almost closest to what it actually is, so that people can practice, and it's pretty great. Yeah. So one question is, how do you take care of your own health, whether that be currently or when you were in undergrad or planning to be a PA? How do you take care of your own well-being?
I would say my first undergrad, I didn't do a good job, if I'm being honest. My goal, again, was to get into medical school at the time. And so I worked, I had full-time school load, and I volunteered. I was not very social. I did everything I could really to make my resume good. I wouldn't say it was healthy. So then when I went into my second degree, I really changed my mindset. I had like scheduled times of when I was going to study. I made sure that I was properly sleeping. I was having regular meals. And the most important thing was being social, because I isolated myself a lot during my first degree, which is only not good. It's bad for your mental health. It really is. At the time, I was working out all the time. I continued to do that, or still do that to this day, but being social and reaching out to family was huge. And I really took more time to take breaks, which I didn't do before. I would be the type of person who would wake up at 8 and study, and then I'd come home and 10 o'clock, study, and I'd sleep. That was it, and repeat. It was terrible. So now, even now, I guess in my job, I really try and leave work at work. It's not always easy, but I try. I do work out every day. I have a puppy, which calms me down, so that's great. I have an awesome partner. I play volleyball twice a week. I like to sing. I watch TV. I read books. Yeah.
That's awesome. Yeah, that balance is always important. That's all I have. So that's where, before we wrap up, is there anything that you'd like to say to listeners who may be thinking about PA for the first time, or already thinking or in planning process? Any advice that you would give them?
I think if you want to be a PA, again, you really have to know that you're going into a profession that is not always recognized. I mean, I work with great staff and I've never had an issue that way, but you might get patient encounters that make you second guess whether you're in the right profession, or somebody will say a comment that can be degrading. I mean, I've had a couple of times throughout my career where a person will be like, well, you're just an assistant, because they don't understand what I'm doing. And that can be very tough, where, they say they don't want to see you because your level of experience isn't good enough. So I think if you're going to become a PA, just realize that people don't understand your role sometimes, and you're going to just have to prove it. As a PA, you are constantly proving yourself. And that might just not be for everybody. For me, I don't mind being part of a growing profession. I think it's great. I'm trying to make a good name for PAs. I guess the other thing is try and look at what jobs are available, and reach out to other PAs on LinkedIn. I mean, I always offer to talk to students. I don't think I've ever got anybody actually messaging me back, but always at these things they ask for my email, and I'm like, sure, go ahead. I never hear back, so
No.
maybe I answered all the questions, maybe I didn't. I don't know. Maybe I deter people, but one thing that was important that hasn't happened, the last 2 times I presented, PAs, again, weren't regulated, and now we're in the process of regulation, which is huge and awesome. So that's something that maybe helps people go towards PA. I don't know, maybe not.
Yeah, awesome. Yeah, no, it seems like reaching out is really important to you, and I think I've learned that as well, just to reach out, and then the worst thing is they say no, or they just don't reply back. But that first step is reaching out. So yeah, thank you.
It's huge. I mean, that's how I got half of my jobs. I mean, my goal was always to work in Kitchener-Waterloo. Every family physician I've pretty much stalked on LinkedIn. And I message personally, and I'd say, hey, are you interested in having a PA? And I had some interviews come out of that, and I've had some opportunities come out of that. And I had a lot of rejections too. But I mean, you have to be willing to create your own positions, and you have to be willing to kind of network and meet people. So yeah, it's huge. The only other advice, like I said, is just try and enjoy university. Right now, I can't even imagine being a COVID student. Sounds awful. But yeah, try and join clubs. I did a lot. As much as I wasn't overly social, I did the study buddy program. So I got to meet some of our international students, and that was kind of fun. Because I mean, if you're going to take a course anyways, might as well help somebody.
Yeah.
So that was really great. I did the SSHT team. I don't even know if half these things exist anymore, but maybe they do. And that was like a mentoring program. I mean, to be honest, most of the time I was just working on my homework or studying, and then eventually, sometimes somebody would come in having some science advice that I would give. So it wasn't a really hard role, but it looks good on a resume.
Yeah.
Yeah, if you're interested, I would say in medicine, I never did it, but some of my friends did the first response team. Do that. That's there for that's kind of the best way that you can actually get involved. And you get to meet obviously a lot of people on campus, and you're practicing some medical skills, which is awesome. And like I said, even approach your professors, like they're very knowledgeable. And had I never reached out to Dr. Reed, I never would have had that opportunity to work with the flies or to do the research at all, because it wasn't posted anywhere. He just happened to say, oh, yeah, let's do it. But yeah, always ask them, because they might have some really great internships or something like that. And co-op, my God, you asked me before, what would I have done differently? A co-op to make money. Yeah, I would have done that. But they didn't have co-op, and they don't have co-op, I don't think, for biomedicine.
I think that pushed you to reach out to different people to get more experiences. So yeah, I mean, co-op is great, but volunteer and other positions are great too. Thank you. Yeah, thank you for speaking with me today.
Yeah, no problem. Thanks for having me.
All right, that's the end of the interview. There are more Healthcare Careers podcasts coming your way, so be sure to check them out. Thank you for listening.